Time to clear something up right away. The size of your disc herniation does not determine how much pain you will have. Not sometimes. There was this recent study I was looking over, and 200 people with cervical disc herniations were looked at and followed for some time, and they found zero correlation between the size of the disc herniation and the and how bad their symptoms were. Okay, so the severity of their symptoms. That's the word I was looking for. So if you've been somewhere, had an MRI, and this pertains to the lower back as well. This specific study just happened to look at the neck. If you've ever sat there and had an MRI done, and the report comes back, and the physician sits you down and says, "Well, this is big," or "This is really severe," or "Man, you need to be careful," then we need to talk, or anything along those lines. They don't understand the reality of what's going on, and they're setting you up for difficulty having full improvement because of the mental picture they're helping you paint. So set up that most, the setup here is that most people think pain works like this. Something looks bad on imaging, and that's why what I have hurts. Sounds logical, don't get me wrong, but it's also almost completely wrong most of the time. Because if it were true, the bigger the problem people have on imaging, 100% of the time they'd have more pain, but that's not ever what we see. So the study I was looking at had 206 people involved. They all had herniations of the cervical spine to varying degrees. They split them up into what they called small and large herniations, and they tracked them over time, looking at their reported pain, the function, and their outcome at the year mark of how they were doing. And what they found was the size of the herniation had no bearing on the outcomes within that timeline. Not at baseline, after treatment, after a year, there was just no difference. Okay? And people with these large herniations did not experience more pain, and they did not end up having worse outcomes. And that's kind of the key to the whole study, is people with any size herniation can have great outcomes, or they can have negative outcomes. And a lot of it is dependent on many other factors. So they had to dig a little bit deeper, right? So if it's not the size of the herniation that makes a difference, and what is it? And what they were finding, this is something that they had noticed in some studies with lumbar herniations in the past, is the answer seems to be more tied with your nervous system, your immuno-inflammatory response, and your body's interpretation of the sensitivity of the situation. So it doesn't just become this big herniation equals more mechanical compression equals more pain equals more symptoms. You can have large herniations, and they see these all the time, with no symptoms. And there's people out there that can have things that you would consider very small if we're objectively measuring them, and be in incredible amounts of pain. And this leads us back to that whole discussion of pain is not a function or direct measure of structural problems or damage. It's your response to the situation. And your response is mediated by a lot of factors. And let's connect this back to reality for a little bit. This is why you, as the person having the issue, might be experiencing things like the pain coming and going, or the pain changing day to day, or it doesn't match at all what somebody's telling you on an imaging report. And if pain was directly correlated to what they're seeing in the structure, then all these things would be very consistent, but it's not. And your body is not this static system. So what does this mean for you? And if you go back and look at this, they do think, when they look at the numbers statistically, it might be somewhere as close to like 90% of people out there, if we ran through an MRI machine, would have a disc bulge or herniation that measures at least 1 millimeter in size in the cervical spine. So just always keep that in mind. So what does this mean to you? It means that you're not fragile and you're not your MRI, and the solution is not to be avoiding movement and training. The solution is learning what can you do in the moment, where is it tolerable, where's the entry point, what can we load, and then turn around and rebuild capacity from there in a gradual and consistent manner. And this is how we actually create change in the system. The bigger issues that they're seeing around why people continue to have pain generators with these types of bulges and herniations, it comes down to the inflammatory response, the body's response to that inflammatory response, and its interpretation of the situation. And if we're not fixing some of the things about the person that can maintain high levels of inflammatory responses in their body, things like improving their general conditioning, improving their general levels of lean muscle mass, reducing their resting blood glucose and their A1Cs, things like that become big important factors. And over the years, I've helped lots of people get out of back and neck pain just by generally improving their fitness, because it helps their body restore themselves to a healthier metabolic environment, so these inflammatory issues are not spiraling out of control and creating high levels of sensitivity. So what does this all mean for you is, no matter how big the herniation looks, you can remain symptom-free or completely eliminate or significantly reduce your symptoms yourself. You don't need it surgically repaired. You probably don't need some sort of injection. But you need to be willing to look at your entire lifestyle to make meaningful progress away from pain and dysfunction and symptoms after you've been told you have something like this. So if this is all making sense to you, or you want to learn a little bit more about my thinking on these things, follow the channel more, drop into Amazon, check out a book I wrote called Fix Your Body. And if you want to really look at how all this operates, we also have the Dad Strong channel, which you're on right now. So there's plenty that you can do for yourself in these situations. Go do something with it. You're in charge. Take control. Now get to work.